Have you ever looked down at your hands and wondered, is my skin trying to tell me something? What if I told you that certain changes on your skin could be the first and sometimes the only warning that your body is entering its final stage? It sounds shocking, but it's true. Most people over 60 ignore subtle skin changes that could signal serious internal issues, even approaching end of life. And by the time they realize it, it's often too late. But today, you'll discover 5 specific skin signs backed by science that can indicate you may be in your final year of life. Don't panic, because there's good news. Many of these signs can be reversed or improved, but only if you act quickly. In a study published in the Journal of Aging Research, researchers found a powerful correlation between skin symptoms and mortality risk in seniors. Your skin is more than just your outer shell. It's your body's largest organ, and it speaks louder than you think. Stay with me, because the most overlooked warning is number 3, and if you notice it on your body, you need to respond immediately. Let's start with the first skin sign: extreme thinning of the skin, especially on the arms and hands. If your skin bruises easily, tears with light contact, or feels like paper, this isn't just age, it's a red flag. Thinning skin often means your collagen has broken down, your blood vessels are fragile, and your body may not be absorbing protein, vitamin C, or other essential nutrients. According to Dr. Emily Harper, a dermatologist specializing in aging skin, when seniors experience rapid skin thinning, it often reflects internal muscle loss, liver strain, or even chronic inflammation. Imagine a balloon stretched too thin. Sooner or later, it bursts. If your skin shows this weakness, your internal systems might be under similar pressure. But here's the encouraging part. Even light strength training, increased collagen intake, and skin protection can help rebuild that strength if you start early. The second sign: patchy discoloration, often on the legs, arms, or feet. It may look like dark purplish blotches or web-like patterns under the skin. This mottled appearance is not just bad circulation. In terminal patients, mottling is one of the final visual signs the body shows before major systems shut down. Of course, it doesn't always mean that, but if you're seeing these changes regularly, especially when resting or after sitting, you may have underlying vascular disease. Left unchecked, this can lead to blood clots, heart strain, or even stroke. Many seniors see these blotches and think, just poor circulation, but they're missing the deeper message. Your blood flow is your lifeline. When it's disrupted, everything suffers. Get it checked immediately if you notice patterns spreading or darkening. Now, let's talk about the most commonly ignored sign: persistent itchiness without a rash. You might think it's dry skin or maybe the soap you're using, but here's the truth. Chronic itching can be your kidneys or liver crying for help. When these organs stop filtering toxins properly, your skin becomes the dumping ground. And here's something few people realize. In seniors, unexplained nighttime itchiness is one of the earliest clues of declining renal function. If you've been scratching more than usual and lotions aren't helping, don't just change your skincare routine. Ask your doctor to test your kidney and liver health. A simple blood panel could reveal a much bigger issue. This is the part where many people start to realize they've been missing the warning signs for years. If any of this sounds familiar, I want you to type the number 9 in the comments. That's how I'll know you've made it this far. And more importantly, that you're starting to really pay attention. The fourth sign is one you should never ignore: yellowing of the skin or eyes. Even a faint yellow hue, especially in natural light, can be a strong indicator of jaundice, often caused by liver disease or pancreatic issues. This isn't a cosmetic issue, it's a medical emergency. If your skin has started to yellow, or you've noticed your eyes looking more golden than white, please don't wait. Schedule an immediate liver function test. If treated early, some causes are manageable. If ignored, the damage may be irreversible. Many older adults dismiss this as just age spots or blame lighting, But your body knows better. Listen to it. Finally, let's discuss slow healing sores or skin infections. If a small scratch or wound takes weeks to close, it may mean your immune system is underperforming. And when that happens, your risk of major illness, hospitalization, and even sepsis goes up significantly. Seniors with diabetes, undiagnosed autoimmune conditions, or nutrient deficiencies often experience delayed healing. Look back over the last few months. Did you have a cut or sore that took longer than usual to go away? Did you notice recurring skin infections, redness, or swelling? If yes, your body might be struggling to regenerate, something it used to do with ease, but it's not too late. With the right support, nutrition, hydration, medical testing, you can turn things around. Here's the truth. Most seniors miss these signs because no one taught them how to read their own skin. They're told it's just part of getting old. But what if it's not? What if your body is warning you because it still wants to fight, because it still wants to live? Don't be part of the 90% who ignore the signals and hope for the best. Be in the 10% who take action. Because the people who live longer aren't just lucky, they're the ones who listened to what their body was telling them. Let's quickly recap. Thinning, bruised skin, patchy discoloration, persistent itchiness, yellowing tones, and slow healing wounds. If you have one of these, it's time to get checked. If you have two or more, don't wait. Your future depends on what you do next, because the earlier you respond, the more power you have to heal. Your skin is not betraying you. It's alerting you. It's asking you to act. So listen carefully. Take a good look in the mirror today and ask yourself, is my skin trying to tell me something? And if the answer is yes, please do something about it before it's too late. Let's dive deeper into the first skin sign you absolutely cannot ignore. Thinning skin that bruises too easily. If your skin tears from a slight bump, if you find strange bruises on your arms and can't remember how they got there, that's not just a cosmetic concern, it's a loud internal warning. This kind of fragility often means your collagen and elastin levels have dropped dangerously low. Your blood vessels are becoming more delicate, and your skin can no longer protect you the way it used to. But here's the part most people don't realize. This isn't just happening on the surface. Thinning skin reflects thinning tissues underneath, including muscles, nerves, and even blood supply. It can also point to deficiencies in vitamin C, zinc, and protein, nutrients essential for healing and resilience. According to a study published in the International Journal of Dermatology, elderly patients with advanced skin thinning were 3 times more likely to experience serious falls, fractures, and infections within the following 12 months. Why? Because the skin is your first line of defense. When it starts failing, the entire system behind it is vulnerable. Take a moment and check your own forearm. Does your skin look almost translucent? Can you see veins you never used to notice? When you gently pinch it, does it take longer than 2 seconds to return to place? These may seem like small details, but they're not. They're symptoms of a body that's slowly losing its ability to recover. And yet, most seniors brush this off. They think, I'm just getting older, it's normal. But normal doesn't mean harmless. If you catch this early, you can fight back. Collagen-rich foods, resistance training, hydration, and protecting your skin from sun damage can all help restore strength over time. But if you ignore it, the damage can accelerate and recovery becomes much harder. That's why this sign matters, not just because of how it looks, but because of what it reveals about what's happening underneath. Your skin is the surface, but it's also the signal. Now let's talk about the second warning sign, one that's often mistaken for simple aging, but could actually signal something far more serious: patchy skin discoloration, especially on your legs, feet, or arms. Have you noticed dark, purplish blotches that appear when you sit or lie down for long periods? Or maybe web-like patterns under the surface of your skin, almost like marbling? This condition is called mottled skin. And while it can be harmless in some cases, it's also one of the most common signs seen in people approaching the end of life. In fact, in hospice and palliative care, mottling is often the first external clue that circulation is shutting down and that major systems are struggling to function. That sounds frightening, and it should, because even if you're not terminal, the appearance of these blotches could indicate compromised blood flow, peripheral artery disease, or early stage heart failure. Your blood is what carries oxygen and nutrients to every cell in your body. When that circulation becomes sluggish or blocked, your skin becomes a canvas revealing the damage. Many seniors ignore these spots, assuming they're just poor circulation or old age bruising, but that mistake could cost them. According to a 2022 study from the American Geriatric Society, seniors who displayed mottled skin patterns during inactivity had a 40% higher risk of hospitalization within the next 6 months. That's not coincidence, it's a warning. If you're seeing these changes, and especially if the spots spread, darken, or become cold to the touch, you need to take action. Don't wait for pain to appear. Pain is often the last stage. Circulation failure begins long before. A vascular screening, an ankle brachial index test, or even just a professional evaluation could catch a serious issue early. The bottom line is this: your skin is mapping your internal health. When it starts showing signs of distress, that's your cue to act. Not someday, but now. The third sign is something almost everyone over 60 experiences, but very few take seriously. Persistent itching, especially when there's no rash. At first, it might seem harmless. Maybe your back itches more than usual, or your arms feel dry and irritated, especially at night. So you switch soaps, buy a new lotion, or blame the weather. But what if that itch is more than skin deep? What if your body is trying to tell you something's wrong inside? Here's what most people don't know. Chronic itchiness without a clear cause is often linked to serious internal organ issues, most commonly the liver or kidneys. When these vital organs begin to lose function, they can no longer properly filter out toxins. And guess where those toxins show up first? Right on your skin. According to research from the National Institutes of Health, unexplained itching is one of the earliest symptoms of chronic kidney disease and liver dysfunction in older adults. And here's what's even more alarming. This symptom often appears months, sometimes even years, before more obvious warning signs like fatigue, swelling, or pain. That means you could be in danger without even realizing it. Let me ask you, have you found yourself scratching more than usual lately? Does it seem to happen more at night or when you're lying in bed? Do your nails leave red marks on your arms, even though there's no rash? If any of that sounds familiar, don't brush it off. This isn't about dry skin, it could be about survival. And if you've made it this far into the video and this part is hitting close to home, I want you to type the number 9 in the comments. That's how I'll know you're not just watching, you're paying attention. Because this one warning, as small as it seems, could be the difference between catching something early or catching it too late. Get your liver and kidney function tested. It's a simple blood panel, but it could give you years more life, and that's worth scratching beneath the surface for. Now let's move to the fourth warning sign, one that doctors consider a medical emergency, yet most seniors ignore until it's too late. Yellowing of the skin or the whites of your eyes. You might notice it gradually, maybe in the mirror one morning, thinking the lighting is off or your eyes just look a little tired. But this subtle yellow tint called jaundice is a serious red flag. It means your liver is in trouble. The The liver filters toxins, processes nutrients, and keeps your blood clean. When it starts to fail, a yellow pigment called bilirubin builds up in your body, and it shows on your skin and eyes first. But here's the frightening truth. Jaundice isn't a disease. It's a symptom. And often, it's a symptom of something life-threatening, like liver failure, hepatitis, bile duct obstruction, or even pancreatic cancer. That yellow tone is not just discoloration. It's a warning siren from inside your body. According to a study from the Mayo Clinic, seniors with undiagnosed jaundice were 5 times more likely to be hospitalized with advanced liver disease within 6 months of first showing symptoms. And yet, many people shrug it off. They think it's diet-related or just part of aging. It's not. If your skin or eyes have taken on a yellowish hue, even faintly, you need to get tested immediately. Not next week, not when it gets worse. Now, liver damage can often be reversed in early stages, but once it reaches a certain point, there's no going back. Blood tests like ALT, AST, and bilirubin levels can reveal the truth in less than an hour. And if you act quickly, you may still have time to turn things around. So look closely, not just at how you feel, but how you look. Your body is showing you something. Don't look away. Let's talk about the 5th sign, one that's easy to overlook, but quietly reveals how well your body is truly holding up. Slow healing wounds. If you get a small cut or scrape and it takes more than a week or 2 to close, if bruises linger longer than they used to, or if you find yourself dealing with recurring skin infections, this isn't just about age. It's about your immune system slowing down, sometimes dangerously so. Your skin is designed to heal. It's your first line of defense. But when your body no longer has the resources or strength to repair itself quickly, that's a major warning. According to the Journal of Wound Care, seniors with delayed wound healing are significantly more likely to develop serious complications, including infections, sepsis, and hospitalizations, within 6 months. And here's what most people get wrong. They think healing slowly is just a normal part of getting older. But the truth is, it's not. It's often a signal that your nutrition, circulation, or immune system is compromised. Diabetes, for example, is one of the most common hidden causes of poor healing in older adults, and many don't even know they have it. Nutrient deficiencies like zinc, vitamin A, and protein also play a major role. So ask yourself, have you noticed small cuts taking longer than before to heal? Have you had sores that seem to reopen or red spots that linger for weeks? These are not just skin issues. They're deeper issues trying to come to the surface. The good news? There are things you can do. Improve your diet, get your blood sugar checked, stay hydrated, and keep your skin clean and protected. But the first step is awareness, because the longer your skin takes to heal, the more time your body may be quietly losing. Now here's the question no one likes to ask. Why do so many people miss these signs? Why do intelligent, caring, experienced adults, people just like you, ignore the very signals their body is screaming out loud? The truth is simple and painful. We've been conditioned to think these changes are normal. That thinning skin, strange bruises, constant itching, yellowing eyes, or slow healing cuts are just part of getting older. But normal doesn't mean harmless. We accept decline as if it's inevitable. We tell ourselves we're fine because admitting something's wrong is scary. We don't want to feel weak or be a burden or face what might happen next. So we wait. We hope it goes away. We reach for another cream or pop a pill or say, it'll get better. But inside, something else might be getting worse. And we're not alone. According to a national health survey, over 70% of adults over 60 say they've noticed unusual skin changes in the past year, but less than 30% brought it up with a doctor. That gap is dangerous. It's where time is lost. where small problems grow into irreversible damage. And what's heartbreaking is that many of these signs show up early, when intervention still makes a difference. But if we don't recognize them, or worse, ignore them, we lose that window. So let me ask you this. What have you noticed lately that you've brushed off? That itch you keep scratching? That cut that's still healing? That bruise that came out of nowhere? What if your body isn't breaking down, but calling out for help? And what if you listened, really listened, before it's too late? Let's take a moment and look back. 5 skin signs. 5 messages your body may be trying to send you before something irreversible happens. First, thinning skin and unexplained bruises. Second, mottled or patchy discoloration. Third, persistent itching without a rash. Fourth, yellowing of the skin or eyes. And fifth, slow healing wounds that take far too long to close. If you've seen even one of these signs, don't brush it off. If you've seen 2 or more, the time to act is not later. It's now. You don't need to panic, but you do need to take it seriously. Because here's the truth. Your skin is not betraying you. It's trying to protect you. It's giving you a warning that most people never get. And if you choose to listen, if you take these signs as the gift they are, you still have time to take back control. Get the blood tests, talk to your doctor, improve your nutrition, move your body, stay hydrated, and most of all, stop ignoring what you've been quietly feeling for months. Because when it comes to aging, survival is not about luck, it's about awareness. It's about people who choose to listen when others choose to wait. And the fact that you're still here, watching this, tells me something about you. You're not like most people. You're ready. So do something today that your future self will thank you for. Don't wait for a diagnosis to make changes you already know you need to make. Prevention is powerful. And the earlier you act, the more years you can add, not just in quantity, but in quality. So check your skin. Look closely. Ask the hard questions. And if something doesn't seem right, promise yourself you won't ignore it anymore. Your life still has so much to offer. Let's make sure your body can keep up.